everyone, my name is Talia Wojtewicz and I'm the Programs Coordinator at Sustainable Innovations. Today I'm going to be giving you a little glimpse of our mobile healthcare delivery program called Arogya, which means disease-free in Hindi. Arogya bridges the gap between people in rural areas in India and the healthcare resources that are normally out of reach by bringing healthcare directly to the patients at a fraction of the present cost. In partnership with TrueWorth, we have developed a software that captures digitized disease protocols and treatments from qualified physicians and accurately diagnoses ailments based on the protocols through the process of elimination. So let me back up and give you a little bit of context. Rural areas in India have been barred from healthcare facilities both financially and geographically. Many villagers in India must choose between foregoing medical help when needed in order to work to provide for their families, or sacrificing a day's wage to travel for hours to get to the nearest healthcare center. With Arogya, having protocols and treatment information accessible via laptop removes the burden of traveling to a primary health center, or PHC. The healthcare services are delivered by local high school educated girls known as panas, who are native to the communities they are serving. They generate revenue for themselves by providing care to as many patients as they are able to. In this way, Arogya encourages women empowerment and social entrepreneurship, ensuring cultural adaptability and sustainability, which is what Sustainable Innovations is all about. Our first stop is going to be on the physician's platform, which is accessible via any web browser. This is what the physicians will see when they log into Arogya. This is where they can access information on the panas, the PHCs, medication information, and disease protocols. This tab right here leads to the knowledge database. This is where the physicians store the digitized disease protocols and treatment options. They can add and edit information for various diseases, including primary symptoms, secondary symptoms, confirmatory tests, prescriptions, and home remedies. This is the PANA application. This is what the PANAs will be using to register patients, record visits and patient information, and communicate directly with the physicians. Now I'm going to walk you through the process of registering and diagnosing a patient. We'll start by clicking on Patient Registration. This is where the PANAs record all of the patient's general information like contact info, birthday, blood type, and they can even take a picture of the patient. I'm going to enter the name and contact info of an imaginary patient here. So I've given my imaginary patient the name of John and all this contact information. When the form is all filled out, I'm going to hit Save and Continue. At this point, Arogya will generate an ID tag for the patient with a QR code for the PANA to print out and give to the patient. This ID tag will be used for future visits. All the PANA has to do is hold the QR code up to the webcam, and Arogya will automatically fill in the patient's details. From here, the PANA can add the medical history of the patient's family, etc. So now the patient is registered and all pertinent information has been entered into Arogya. From here, we can start the triage process. For the triage process, the PANA sits beside the patient and asks the patient all the questions prompted by Arogya. We'll start by clicking on New Visit. At this stage, the PANA can either hold that QR code on the ID tag up to the webcam, enter the patient's ID number, or just search through the system by typing in the patient's name. She'll then add the necessary information like temperature, weight, height, etc. Then she'll fill in what the patient's primary complaint is. As before, I'm going to make up John's information. So I've got John's information all filled out for this visit. For his primary complaint, I put fever, vomiting, and aches and pains. I also recorded that he has a temperature of 101 degrees Fahrenheit. In cases where the patient's fever is extreme, say 104 degrees or more, Arogya will prompt the PANA to end the triage process and send the patient to a PHC right away. Now we'll go down to where the primary symptoms are listed. Since John's primary complaints are fever, vomiting, and aches and pains, I'm going to select fever, pain in the body, and vomiting. As I check off these symptoms, Arogya will list the attributes of the symptoms in the middle, and also the possible outcomes over here on the right. Now the PANA will go through each attribute and ask the patient questions to further narrow down the possible outcomes. You can see that as I check off attributes, the possible outcomes list gets shorter. The triage process is pulling information from the knowledge database that I showed you earlier to match the patient's attributes to the attributes of the symptoms in the knowledge database. Once the attributes for the primary symptoms have been filled out, I'll click the Next button, which will bring me to the second tier questions. This step uses information that I filled out from the previous step to help further narrow down the possible diseases. The second tier questions are specific to the attributes selected from the previous step. Again, the PANA will ask the patient these questions and select the patient's answers. Now that we've gotten to the third tier questions, Arogya has narrowed down the possible diseases list to 1, malaria. The third tier questions involve confirmatory tests for this disease. At this point in the triage process, all the patient's symptom information has been inputted into the system, and Arogya has come to a diagnostic conclusion. In this case, John has been diagnosed with malaria. Along with the diagnosis is a disease description and treatment plan. Again, all of this information is coming directly from the knowledge database. Here, the PANA has the ability to send a message directly to the physician should she need to relay any additional information regarding the patient. The physician will be able to see the PANA's message when he or she gets the new diagnosis alert. Now that everything is ready to be sent, I'm going to click on the Refer button at the bottom and then sync the program. Now we're back to the physician screen. Anytime there is a new diagnosis for review, the physician will be able to see it right away on the home screen. Here is John's visit information. The physician will click on this button here to view the entire report. This is also where the physician will submit prescription information. Here is an in-depth report on the patient's visit and diagnosis. On the side here is the patient's vitals. Up here at the top is the name of the PANA and the PANA's phone number, should the physician need to call the PANA directly. Down here is where you can see the PANA's comment. This is where the physician can send treatment recommendations based on the information above. I'm going to send the recommendation, enter home remedies, and also enter a drug recommendation. Once everything is all filled out, I'm going to select Save Recommendation. At this point, Arogya will generate a prescription with all the relevant information. The PANA will receive this automatically, and there is also an option to email the information directly to the patient. Now the PANA will get a notification that the physician has sent his or her recommendations. When the PANA opens the window, she'll be able to relay all of this information directly to her patient. All of the communication between the PANA and the physician happens in real time. Once the PANA has relayed everything to her patient, she will check the Visit Completed box. This concludes our brief tour of the triage process of Arogya. For more information on our program, please visit www.si-usa.org.